All right, so everybody, we have always called this the PFACT, but we are actually, per DHA, we're going to be changing it to the Patient and Family Partnership Council. So they decided, huh?
I don't.
I said, well, that's it. I'm not coming anymore.
They said it's a better word because we're a partnership together, both our beneficiaries and the people who work here.
Somebody needed a bullet for an OPR.
Next slide. So these are the things that we're going to talk about. Next slide. I don't like to read that part. So every start of the meeting we have to do, which is called a safety moment. This is a new website. Well, not new, but it's new for everybody to use. This is everybody, not just the people who work here. They have a lot of information on here. You can see what the access to care is here. That's the big one that they wanted us to hit, which is this little icon right here. You can see like when the next available acute appointment is or a future appointment, things like that. It kind of will have more information sooner than we can get it out to you, I guess. So that's our safety.
So is that like the link to MyCare, I'm assuming?
No, it's completely different. It's a health mill.
But is this like
So
like
that's
you said, the access to care?
That's a public website that has all the MTFs
Yeah.
information on it, so it's visible for us and beneficiaries as well.
Mm-hmm.
So it like has statistics based off like access to care, what type of services there are to offer,
okay.
statistics on stuff like that.
So for, let's say you were going to Hawaii for the weekend or something and you want to see their access at Hickam because maybe you got sick while you were there, you can actually see kind of what's going over there. I think it's pretty neat. Next one.
Can we go to Hawaii for the weekend?
Got the money.
Ray ain't gonna tell you, no.
This right here, it tells us like they pick the wild child's visits, so it gives you like an average on how they're doing, things like that, and how well you can get access to it. Cool. Next slide. So everybody knows what Joe's Tea is in this room? So if you don't know, Joe's Tea is just a text message survey that's been sent out to the patients. So DHA or AFMOA wants to know from you guys what 4 questions, so it's 4 to 5 questions that they ask you, and they want to know what questions you would like to be asked. So just so that you do know, is it on the next slide? Did she put them on there?
Yep.
We'll go to the next slide. These are the actual questions that are going to be asked to the patients when you get seen for an appointment, and then this is what's going to be texted to you. So of course, overall satisfaction with your visit, satisfaction with your provider. They want to know if you were told to call back, and then if you're able to see your provider when needed, and then you have that comment section where you can write whatever you want. So, does anybody have any suggestions what you would like to be asked instead of these questions right here?
Is there an option to have someone call you?
Call you back?
Mm-hmm. Like say I have a concern or a comment, I'd rather you're talking to someone because some people, I don't want to write a paragraph on my phone. Can I just have someone call me?
That's a good question.
Like a patient advocate or what's Colonel Westfall's home number would be great for after hours care. Or actually it would be Colonel Conroe pretty soon switching over to the benefit side.
Look how happy he looks
I
about
will
that.
forward it to Colonel West.
Anybody else have any questions they would like to be asked?
Question? Want to draw? Draw me some notes.
Do you know if there's going to be, are they limiting it to 5 questions?
So for right now, they want to limit as much questions as possible. They don't want it to be super long like the original Joe's Teas, which is that 25 booklet questions. So they want to keep it small.
I guess I would be concerned if the patient had to interact with one of our ancillary services, Farm Red or Lab.
Yeah, because right now in the testing phase, it's only hitting patients on primary care visits. Mm-hmm. So that's I think when they go fully live, I think it's planned to be.
Our ICE survey is almost live. We've got a couple more things to go through. So we could post signs of each window, each service area saying, you know, rate us on ICE, or if you have a comment, give it to ICE. So that would be an outbound way of soliciting, and this would be a way to push something to someone.
Not to get off track, do you know if our ICE survey has a clarifier about what status the patient a student active duty.
Lieutenant Guthrie set that up. I only got the call stating that your ICE is not working yet, that there's a few more things that need to be done. So I would let him answer that. Sir, quick question on the future ICE survey that is being created. Do you have a qualifier in there stating who you are? Are you a student, permanent party,
Yes.
beneficiary, or other?
That's part of the draft that I'm putting together. Actually,
Perfect.
I actually pulled some surveys from Shannon for their like post-ops and post-visit, and a few from community as well, just to kind of cross-reference and see what they're asking patients. And then obviously we have the Joe's questions that we're asking, and the first thing on there is going to be permanent party, students, branch, things like that, so we can filter and figure it out. Who our target audience is, what the response rates are.
Awesome.
And we'll also have an internal one that's gonna match the ISO and it does ask that question. No one asked last minute what you guys would like to see when they text you if you opt to for that option?
Is this going to be individualized for each MTF?
No.
No.
No,
It's
this
just
is
standardized
this is
product.
standardized.
I was just going to say,
Yeah.
because you could put on there, answer this survey, or if you have an immediate concern, you can call the patient advocate at blah, but if we don't have that, this is a national product.
Yeah. Yes, sir.
It's not too late. So, sounds like question number 3 should be a sub-question.
We actually did talk to them about that question because the your selections are gonna be like the original Joe's survey is like satisfactory to unsatisfactory kind of thing. So that question, you can't really answer that in that perspective. So we're trying to see if they're saying just yes or no.
Just seems like sort of out of context in a way if it's by itself, so I don't want to confuse the patient.
Yeah.
So this is the pilot, remember, so I'm sure there's going to be a version 2,
Yeah.
you know, months after we roll this out to the rest of the DoD. For us, I think they really focused on just being able to get the system to work with CHCS and us be able to actually pull data that's worth it, and then from there they'll start doing more fancy things with it. So
Question 4 is kind of strange too. It doesn't really fit. Was I able to see my provider? Was I able to get an appointment when needed? Because they're obviously checking in. I mean, that's what's going to generate the Joe's T survey is I'm here for an appointment.
So the way that it's stated and the way that it's meant to be sent out to the patient is that if you were, like, for example, you had an acute issue, were you able to get to see the provider that same day or the following day versus being seen a week out? That's what they kind of mean, but it was stated this way, but they do know about it. So like I said, like Lieutenant Guthrie said, it is a piloted thing, so it's still in the process of working. So that's why we want your input to make sure that we can adjust things and make it better.
And we do have the Tuesday phone calls with Janice and Afroa, and since we're like the only couple bases, that's definitely a platform for us to go ahead and give feedback and make changes. So they still have the capability of doing that if we give them a good justification behind that feedback.
Yeah, they are the ones who asked me to ask you guys what you guys think so we can give this feedback for them on Tuesday.
Yeah.
You should call it coffee with Janice.
Yeah.
She's fun.
Go ahead, next one. So our next TRICARE representative will be here on the 20th of May at 1 o'clock. And the location is going to be at the front where it always is, and there'll be a table set up with them there. This part right here, the TRICARE booth, I pretty much got all the stuff that we need, so look here in the next week or so, it should be out there. As soon as you walk in to the left, there's like going to be a stand right there with all the TRICARE stuff that most commonly questions and things like that are asked.
That's for the other 29 days of the month when there's no representative.
Yes, ma'am. Sorry. This is, so just to let you guys know, we are doing a whole bunch of different DHA guidelines that they're bringing in, policies they're bringing in. This is just for you to go ahead and read and see what we're doing, just so that the population is aware of the changes, things like that.
So
Yes, sir.
Are you two aware of even what DHA is? Because it's going to affect you where you're going, but
We've been talking about it.
okay, so DHA is Defense Health Agency. Is essentially okay. You
Figured
said,
it was something
Okay,
like that.
yep,
I mean, I didn't
yep.
know that. It's not one of my common
It's okay.
acronyms. I
It's-
have a lot of acronyms.
It's something new you should know about. I shouldn't say new. It's been around for a while, but they are taking control of all of the military treatment facilities for all of the branches of government
Oh.
for the delivery of the healthcare benefit to everyone other than active duty service members. So in some way, shape, or form, they're going to touch everybody.
So this is actually a policy in regard to PFAS. It's actually really important. So I'm pretty sure Colonel Morales put this up. So it's a little crazy, but everybody that participates in PFAC has to be HIPAA certified in a sense. So based on this policy, it's required for all volunteers and participants, including civilians. So what we figured out is we'd probably just make one of the PFACs a quick presentation on some HIPAA guidelines, and that fulfills that. And then have a signing roster. We're good to go. We also have to provide rights and responsibilities to make sure that people understand they're not being violated.
And that's already been completed, so
Yeah.
the next one around, all this pretty much will be done, will be in the next meeting. We'll have a HIPAA person coming in to brief you guys. The patient rights and stuff like that will be provided to everybody. You'll kind of get like a welcome packet, even though most of you have already been here already.
Yeah.
And then the non-disclosure agreement will be done by then as well. It's pretty much done already. We just need the final good to go.
It's because a lot of the other MTFs around the Air Force are catching up to this PFAC model. They've never had a PFAC, and they're just starting their PFACs up because it's now becoming a requirement by DHA standard. So we were piloted. We've been doing it for a while. We've been kind of doing it on our own terms. DHA is caught up. They now want every MTF to have one, and these are the requirements that we have to make sure documentation-wise that we meet their standards.
Yes, ma'am.
Long ago, we signed some paperwork. I'm pretty sure there was non-disclosure paperwork there and something else. I don't
This
know
is
what.
going to be almost just like that, just a little bit more formal.
A
Just
new
so we
logo on top.
and the new name, things like that. Yes, ma'am.
Ooh.
Yeah.
I love signing more papers because they have a new
But you're actually, it's like you're part of the
You're part of the team.
You're part of the council, like officially part of the council.
Yeah, there's a charter. As for social
Oh my
media, it's
gosh.
just viewing. So, and then obviously when we turn off for the rounding, sitting down and talking about more patient-specific things, that's when we'll turn off the camera.
Next slide. All right, so actually, you want to go to the Joes? So everybody knows this part where we look at the statistics. So it says recommended facility to family member or friend. For March, we're at 57.4. Yeah, go ahead, next one. Able to see provider when needed. Can everybody, the numbers are on the top. Next one. Provider treated me with courtesy and respect. Next slide. Provider explained things in a way that was easy to understand. Next slide. Provider's team considers my values and options when we make decisions about my healthcare. Next slide. So these are the positive comments. Can you read them?
Dr. Omega said he wants a plaque now. Said you need to give me my kudos.
So how did number 3 get on there if this is the Joe survey?
It was in there. In the
No,
comments.
I know it's on the response. How did they get his Joe's survey if their doctor is off base?
came to get a referral, maybe?
I don't know.
Yeah,
They
that
could have
just
gotten a
seems- yeah.
referral,
But with that,
and then it would have generated a TCON. I don't see how that would have been an encounter.
I'm just curious. I'm just
Yeah, that's interesting.
recognizing these?
Yes. So what I've been doing now is I'm sending them directly to the person now, and I'm also like making sure that their supervisor or the NCOIC, some type of leadership knows, so they can make sure that their people are.
That's why you
kudos.
attacked me today. Got it. Alright.
Negative comments get a lot more coal.
Because it's good for them to know that they're doing a good job too. Next one. So these are the not so happy people.
Okay, the first one doesn't seem to understand the referral process.
Helping person to select provider and access. I get mine in my email.
I guess this is areas to improve because we need to open a discussion, hopefully with everyone, and tell them, we offer this as a service.
Mm-hmm.
We would like for you to come in and work with us, and we'll get you an appointment. We'll assist you, but you don't have to do it. You can go home, wait for the referral to activate it, and you can then call TRICARE and discuss with them who you want to see. But it is, if you don't understand the process, it seems very cumbersome. So that might be an area for us to improve on.
Educating the patient a little bit better.
And give them their options of what we can and can't do. Was not given the, is that a swear word?
Yes.
Okay.
Yeah, they usually
What paperwork?
I'm assuming that this is probably a pediatric patient. And they're given certain paperwork to make sure they meet milestones. And this is one thing we've struggled with, is how to get this out sooner. If people are on MyCare, we can send it directly to them through secure messaging, or else we would hopefully like to get this online somehow, but we do not control the external website that is seen off base. That is through wherever in the MHS or even Air Force in general owns that website.
I think that's PII that they do that too, because they're saying what year old of the
No,
child.
it.
Oh, was it? Oh, okay.
you saw the actual rate.
Yeah.
But again, this also frustrates them because this should be done at home. Yeah, you can fly through it in 15 minutes while you're sitting there, but it really involves some thought to make sure that your child, hey, did they really do this? And
It's also too, just because P is not here to kind of explain themselves, but I know that they have in the past done where they mailed stuff out and we're not getting stuff back. If someone else had an appointment, like their sibling, they would give the parents the paperwork because their next sibling is going to come in and they would not bring it back. Or they forgot it at home, things like that. So they have tried multiple things. They do secure messaging and send it to them. They do call them and ask them if they want the paperwork first too. So
right.
they do a lot of things. It's just, sometimes stuff happens.
Right. And we really want lots of thought in that paperwork to make sure that the milestones really are being met, not just a yep, check mark. And the last one, we agree, we understand we're having an issue right now with access to care.
That's it. So this is just courtesy and respectfulness of clerks and receptions. Helpfulness of clerks and receptions. That's it.
Didn't you say you were going through some training up front, or lots of new people up front?
So we did do some training. We're going to do more training again this training day, being more of phone etiquette. Being able to handle situations where either the patient is getting upset and how we handle our side to make sure that we calm them down, things like that, that we can make sure that we get help them the best that we can.
Mm-hmm.
So yes, we are doing that a little bit in depth more this training day, but we did go over stuff last time as well.
Weren't you getting new employees up there? Was that what I heard? Or no?
There's technically only one, but we're doing a new process and all the new guidelines and like this. It is gonna change it. We want you to know about the new process because when you go online, sorry. when you're calling in things like that, things are gonna change. Appointments are gonna be made just a little bit different. Right now our access to care is not the best, but we're trying to do what we have. So we're just trying to educate the beneficiary populations on the constraints that we have in the med group right now against what they may perceive or what's they're seeing what's actually happening behind the scenes. But yes, they are getting additional training again this coming Thursday.
So just to add on to that, so last couple months they've been, probably about 5 months ago, everybody's kind of operating their own way. So last 5-6 months they got together as a collective group and they developed what we call a 797, which is a training task list, and they have all been going through all the training the same exact way. So they're operating the same exact way. So although there was only one new person that joined the team, you can almost say all of them are more or less kind of new because they're all relearning or learning new things that they didn't know about. And then now with the capability of listening to recorded phone calls, they can now listen to those recorded phone calls and hold each other accountable on all different levels to make sure that they're getting trained appropriately. So that's kind of where we're at right now. They are pretty darn close to being overall trained up. There's about 80 tasks total, 80 training tasks total, and they're in their 70s right now, I believe, for being signed off. So they're almost done with being signed off, and then now they're going to focus on recorded phone calls.
Yeah.
So.
I do know because of new DHA, that whole process they just learned, now they're going to have to learn something a little bit different too. So there's going to be a little struggle to get that going as well too, because it's going to change a little bit more for them. So we are working hard to make sure that it's a streamlined process where there's not too much hiccups in the way.
And the only other metric that you guys are not seeing up here, this is Joe's for customer service, remember? But you're not seeing what we call telephony metrics, which is actually their performance. So their call time, drop calls, things like that. And once we finally get that up and going.
Oh, actually, it works today.
Oh, so you'll actually get to see the performance stacked up against perception of customer service, and kind of go from there. You typically, they do about 2,000 phone calls now. That's what they're looking at. So they do a really good job with 2 clerks.
So you said call time. Are you talking call time between the clerks and the patient, or call time between the clerk trying to get a hold of somebody back in the NTI?
So actually, they have to follow, they're supposed to try to meet a matrix.
Mm-hmm.
So service level is the overall service level that they have, and they have the Air Force standard is 90%. Then you have your call time, which is they should typically, it doesn't have to be, but they have to meet 180 seconds, which comes out to 3 minutes per patient. Now, if you go over that, if you're taking care of the patient, you're taking care of the patient. Quality over quantity. And then you also have another matrix where it's 45. We have to have. There's only can be 45 seconds until that person that you answer the next call. So that call in between, it should only take 45 seconds for us to pick up that call. Again, if you're on the line with somebody, sometimes if they need more attention, we gotta take care of them, make sure that they're good to go before we can get to the next call.
Because there have been times in flight medicine where I'm the only one there, and everybody else, including Sergeant Mendes, is out there taking care of patients.
Yeah.
And you're not going to meet that time.
I know the struggle, but like we said, quality for the patient over quantity. I'd rather make sure that we're taking care of the patient that's on the phone. Yes, unfortunately, we may drop somebody, but as long as that patient is being taken care of, that we're talking to, that's our goal.
So, question for you. This slide has nothing to do with your training. You're talking about training them in processes.
This slide is for, go ahead.
Yeah. Tell me about this one.
So this slide, it's not just, so it's going to be your front desk people, it's going to be where referrals are, the front desk, and it also takes all the auxiliary service, so the people at the front desk, people on the appointment line, things like that. So it's
inclusive
everybody?
of all clerks, so
Yeah.
any clerk excluding dental. Technically, they could give probably a Joe's for an appointment they had with their PCM and also had a dental appointment, and then it's really any clerk that they engaged with, whether it's referrals, front desk, family, or student side. So
Sure. And this is probably going to be a priority for the commanders, but I don't care if my person doesn't know anything. But if they help me and said, you know what, I don't know, I'll find out.
you go back.
Yeah. Yeah, this was the first of the 2 slides, so that,
The next one's one.
yeah, but you can go to the next one. Oh, I'm sorry.
Oh, yeah.
Helpful,
Just
yeah.
those 2.
Helpful. Sorry, there was so much to say. Yeah, no, but I hate seeing that downturn because I'd rather tell people right up front, you know what, I really, really don't know, but I'm going to find out for you and let me get your information. I'll have someone reach out to you. What can we do to turn that curve around? Because we're not going to have the answers right now.
So I know of some people that have now seen this are patients who have came and brought it to my attention and have actually stated that they put something like this is because we can't help them as far as I can't get you an appointment. And they're basically, well, you can't get me an appointment, I'm not helping them. But that's our access to care is
Sure. And this is it's an odd question. It doesn't, overall, it's not specifying something. It's just saying, were they helpful for you? Well, no, I didn't get my appointment. Well, no, but did they give you options? Did they give did they get you in touch with someone?
So with the new DHA policy, it actually, they do more scripting for us, pre-scripted, which will help more with this because it's easier to follow.
And there's a trend I'm looking at, like during PCS season, it looks like
It
we
dropped.
had some solid scores in July, August, and September. So it'll be interesting to see where we fall.
And this is all pre this recent training because that only
This
goes
is
to
March.
March.
Mhm.
Yeah.
So we're not seeing up to the minute. Is Joe's going to be any quicker turnaround once we're on T?
It's the 15th
15th
month
of
of the
every month,
next,
yeah.
the following month, yeah. They're like a month behind.
It'd be interesting to see, since the contractors were gone in April, come back to late April, what happened with that too.
But this does help me because it does let me see that there's a concern in that area so I can make sure that we tailor the training that we do a little bit different. That's why I want to talk more about phone etiquette, make sure that we're, talking to the patient appropriately, make sure that we're taking that extra step to make sure we have that good bedside manner on the phone.
And it's one piece of the pie, So you have Joe's, now that we have telephony, and then we'll have the ice, and then you bring it all together. And we'll have a full picture going into the summer of how the overall customer service is for the team. So, or for the clinic.
This is just one small, tiny little slice.
Wow.
Exciting.
The Marines came to save the day, huh? What about the Air Force?
Do you want us to go over this stuff? I don't.
Yeah, sure.
That
You guys
was
got
This
is that
is
here?
the Air Force stuff.
It's March to
The Air Force.
It's
has
March.
saved the Marines because the Air Force
Is it April?
better.
March to April.
15th.
So yes, he's meeting us again.
Okay. You've been hanging out with
Info
the Air Force.
Street.
Oh, they have a better.
But overall, we're doing really good as far as getting views and people coming to our website. So if you haven't
Is he posting
seen our
dad's
website,
jokes?
posting what?
Is he posting
To do it like
dad's jokes?
I don't know, sir.
I do try to do a weekly dad joke.
See, that's it.
That's it. We gotta do
Everybody
dad
loves
jokes.
dad jokes.
Got it.
I'm not quite as seasoned as him in that department. I'm getting there.
You guys have the metrics for the back to school event? Because last I checked, you were somewhere in the ballpark of what, like close to 700 reached?
Mm-hmm.
Yep.
Somewhere in
700.
there.
Mhm.
Okay.
Customer service, this is the bit metrics for that.
Has everybody seen this video?
Yeah.
Okay. So, well, that is April. We're pretty steady.
Well, everybody learns something.
Yeah, so all the hard work that you guys did with creating the packages, newcomer packages and the magnets and things like that, and all the feedback, that directly goes into these newcomer orientations. The one at the, what is it called?
Heartlink.
Heartlink. And really anytime that we have any type of conversation with a patient, that is literally one of our tools that we use. And we've seen a consistent grade. We usually fall between number 1 or number 2 on BSAS for briefing, for information about our services. So it's been very consistent, and those tools have had a few people already come up to me and say this really helps. I refer back to it all the time. Even the magnet just being on the refrigerator. So that is an attestament to your guys' hard work to see the consistency over months of how that tool's impacted this newcomer orientation. So
The uniquely shaped magnet.
Yeah, next slide. So
These are just the
these are
court
just
dates for it.
dates.
Mhm.
You can see.
So I'll probably bring the ICE survey to the next, well, I'll definitely have it ready to go for the next PFAP for you guys to review it. That way we can roll out all the stuff that you were talking about together, and we'll be good to go on that.
I don't know, do you want?
Provide a collaboration date is,
It's going to be in September, the first part of September, with our new MDG commander. And just in case anybody doesn't know what that is, what they do is they bring the outside providers in so they can actually meet who they're giving your referral out to, things like that, so they know who they're working with.
just TBD.
Next slide.
Should have dollar signs behind that.
Dollar sign. Yeah. Huh? Oh. Bye.
Just cut it.
You put me on the spot.
Oh,
Ouch.
you needed a new
I don't have my case.
Oh no, that's on right now. It's still live.
It's horrible.